to previous syllabus. I think few changes are there
This
because
call is now being recorded.
I just wanted to convey like a few changes are there in your syllabus. I guess I think in your senior syllabus there was something like introduction to the fundamental of karma, Nehana karma, and Svedana karma, and as like Vamana, Vrechana, Bastinasya, and even Raktamokshana was there. I think in your syllabus they had mentioned just a point as Raktamokshana. It is not in detail, okay? And when you come to the fundamental of Panchakarma, it's not necessary that to go in detail. I think moreover here, like most of the question which we are which they ask in the fundamental of Panchakarma, like something like introduction to Panchakarma, it will be like introduction to Panchakarma or Panchashodhana. Most of the questions which will come for around 5 marks or 10 marks, it will be like I think I'm telling in the first point in your syllabus, that is like introduction to Panchakarma. I guess like it will be like Panchashodhana and Panchakarma. There are 10 marks or 5 marks questions will come in this name in this introduction to Panchakarma. Otherwise, the Trivida Karma, most of the time they are asked for 10 marks, Trivida Karma. You can write it as like Purva Pradhana Paschat, as you explain any therapies like Purva Pradhana Paschat. In the same way, you can explain Trivida Karmas with, if you explain with any procedure that will give, I think that you can fetch more marks while writing 10 marks, or if you are writing in a 5 marks, you can just give a outline, that is enough. And then you, and one more important concept is that in fundamental of Panchakarma, that is like Koshta and Agni Pariksha. That is very important in Panchakarma because in any Panchakarma therapies, we have to assess Koshta and Agni Pariksha. So in the theory, this is the important question which you can consider in the first chapter of your syllabus. And one thing I suggest, whenever you write your question, it may be 10 marks, it may be 5 marks, it may be and something like you should, it is not like a paragraph. You have to write in proper headings and subheadings with a flow chart. Like whenever you write any therapies, after the therapies, you just write it in flow chart, like mode of action, something like. Otherwise, if you write it in a paragraph, no one will read, and I think that will take too much time for you because I think most of the time we neglect Panchakarma paper because it's a single paper. Okay, but when we write whole 100 marks paper in within 3 hours, it takes too much of time. So when you're writing it, I think my suggestion is most of the time whenever you write this thing karma kata and mode of action, you just write it in a flow chart. If they're asked individually in the 10 marks only the karma kata, then you have to write it in full detail. Otherwise, it has come as subheading, then you can go with flow chart rather than writing in a paragraph thing. Okay, and like other thing, I think you know the this thing principles of Shodhana. And one more thing, don't panic when they ask for indication and contraindication, whether to write the shloka or how to buy the big shlokas. Like you can do one easy tip is that whenever you're writing indication and contraindication, or whenever you're learning it, if you feel difficulty, just remember the terminologies in Sanskrit. Like when you are explaining indication and contraindication, if you can learn, it is well and good. It is well and good. If you're not, you can use the terminology in while writing indication and contraindication. That is a best marks in that. Okay, and without considering shlokas, terminology, difficult. In other people also can write, you can use the terminology. That will be the best thing. Okay, and then we'll go to next chapter then. It is like Snehana. The next chapter is Snehana Karma. Okay, in Snehana Karma, I think if you see overall the main aspects we have to consider, that is same introduction. First one is introduction. I think the most of the time as a sub question, etymology and the definition Sneha and Snehana it will come. Otherwise, with that, like in this chapter, like 10 marks or 5 marks, I think uh, something like etymology of sneha, and with that Bahya and Abhyantara sneha, it may come, or any procedures. It may be Bahya sneha procedure, something like Shirodhara, it may come. Or Shamnartha sneha, and difference between, and one more question, it may come like difference between Shodhanartha sneha, Shamanartha sneha, and Brahmara sneha. That you can focus on while reading it. Okay, the mainly thing is difference, and other thing is like other 10 marks question in Snehana is like Murdini Taila. Other like you can prepare yourself for the 10 marks. In Snehana is like Murdini Taila, that you can write Shiro Abhyanga, Shiro Seka, Dhara, Shiro Pichu, and Shiro Basti in that Murdini Taila. And you here also same thing, like whenever you're writing it, you just follow like as I said before, like you make a proper alignment. Like when you write like if they asked for any like something like Shiro Basti, okay, you just have to write like start with the definition of Snehana, then which type of Snehana it is, whether it is Baya Snehana or Abhyantara Snehana, then you go for the therapies. Like in that also you can write in like Purva Karma, Pradhana, and Paschat. And after that, after all this, the very important, more fetching thing is mode of action, how it act. That you can write it in. It may be 5 marks, it may be 10 marks. You have to write mode of action for each procedure. Then only you can fetch more marks. Mm. And and other thing is like main like every time they ask like Kruta Lakshanas and Taila Vasa, that Triru Sneha and Maha Snehas, okay, and Acha Sneha and Pravicharana Sneha, okay. And I think in Bahya Sneha, I think you know that like it may be Bahya and Abhyantara. Like as I said before, you just follow like Purva, Pradhana, and Paschat. It will be easy, and that will be simplified. The main points will be completed. Otherwise, paragraph again the same thing will repeat. So you just focus on that. And one more thing, the calculation of Shodhana Sneha, that you have to focus. I think in Shodhanartha Sneha, if they asked, you have to mention the that point in that. And Anupana of Sneha also. And one more like Jirya and Jiryamana Lakshana of Sneha. And Sadhyo Sneha. And Snehana Karmukata, as I said, like mode of action, that you have to write it. And Samex Nidha Lakshana, like in each procedure, don't forget to write something. Like I think if you get Shodhanartha Sneha, like as I said, like started with the basic introduction and Pura Pradhana Paschat. After writing all this, then you have to write the Samex Nidha Lakshana. If it is there for 10 marks, you have to write Atiyoga and Ayoga Lakshana and Samyak Lakshana. After that, you have to write mode of action. Otherwise, if it has come for 5 marks, it is not necessary to in detail. At least basic things you need to cover it up. Okay. And other, like as I said, like other procedures like Bahya procedures like the Takradara, Udvartana, Anjana. And one more question I forgot to tell you, like that is like the difference between Gandusha and Kavala. That is the most common question that you have to focus while reading it. That is also one of the thing. And if you come to the next chapter, that is Svedana Karma, and that in this also same thing. You start etymology. I think most of the time Snehana etymology is asked, not the Svedana one, but you can focus. And one more thing you have to focus is Sveda and Svedana, difference between Sveda and Svedana, or definition of. And I think in the Sneha, the classification of Sneha, you have to think, like you have to learn, because I think different types of acharyas are told different. I think while writing it, you just write it in a flow chart, not like no, not in a flow chart, at least in a diagrammatic pattern. Like if you write it in like in a proper paragraph, you won't get it. Okay. And if we come to Svedana, like same as I said, like indication and contraindication of. And the main regular asked question is Agni and Niragni Svedana. That is also, and I think it may come like explain Sveda or Agni Sveda, Sagni Sveda, that it is that must, or local bastis like Kati Basti, Janu Basti. That and the same thing is like Samyak and Ayoga and Atyoga bastis. Okay, that thing. And one more thing is like whenever you're writing any procedure, just write Parihara Vishaya and Parihara Kala. I think that we usually forget it while writing the procedures. Not in depth, at least a sentence I'm telling, like not in detail. Just mention sorry Parihara Kala, or I think it is Parihara Kala more important in Basti rather than Svedana. Okay, and I think in some cases like Gridrasi, Amavata and Pakshagata, they are asked like particular treatment. I think in this you have to write clinical utility. Example, if you're you're explaining Katibasti and you are mentioned like in particular disease, something like in Sandhivata. You are writing in Katibasti, sorry, Janubasti in Sandhigata Vata. So why you have choose particular oil for the Janubasti, and why you have chosen Janubasti to that patient? Because you have to you have to mention clinical application in this. Then only you'll get more marks. At least not elaborately. At least you have to mention a line. If your example, I think in most of the Vataja Sandhigata Vata we use Dhanvantari or Nirgundi Taila. So you can mention that. Okay. And in Amavata, Amavata we use Vata Kafara Taila, something like Sacharadi Taila or Saindava Taila. Like that you have to go. You have to write it in the while explaining the procedure after like something clinical utility or clinical application. That thing I'm telling. And even here also you have to write mode of action. Then only you can fetch the more marks. And how like selection of oil and the time limitation. I think in Snehana it is differs like in I think in skin cases as per Sushruta they had said like Shodhanartha Snehana you have to go give only 3 days in the skin cases because it increases Kafaruddhi. So in the same way there are some limitation in Svedana Karma, in Vatarakta, in Pakshagata, in okay, that limitation they have to learn while writing the uh, or clinical utility in particular diseases. So that you need to learn, because if you make the mistake, I think your whole what you're explained that will become wrong. So at least you focus on those diseases, at least especially on Vatvadis, like something like Pakshagata, Vatarakta, Garudrasi. Hmm? And whenever you write, like I said, like while writing 10 marks, you have to write the Kamukata of Svedana. If you don't know the particular procedure Karmakatha, at least you write down the general Karmakatha of Svedana or general Karmakatha of Snehana. But don't forget, like, don't skip that part, okay? And one more thing, like Sona, other one is like Sona Bath. That I think the more question they ask, like Sona Bath also, it is very important. And Kuti Praveshika Svedana, that also it is very important. That we have to learn in detail, okay? And the next one, like the next one is like physiotherapy. I think here, I think it is in your syllabus is very less. I think if you see the marks marks alignment in your syllabus, something like in physiotherapy, they had only taken only 5 marks from your physiotherapy. That I think that is not much important, but I'll just tell you which questions may come or which points you have to focus on these things, because most of the marks which is covered in your syllabus is like 18 marks from Basti Karma and 10 marks from Nasya. Like highest marks is from Snehana, Svedana, and Basti. Then they had told about Vamana and Virechana. That is like 10 marks each. And in physiotherapy, I guess it is only 5 marks. Physiotherapy and the last chapter, which is emergency management and research subjects. Okay. So like if you see the marks, like by that only we have to like just think like we have to go in a gross level, not in a the depth level. So in physiotherapy, I think most of the time it will be like not like exactly what is physiotherapy and something like that. It is something like electromagnetic therapy or infrared therapy, shortwave diathermy, and paraffin wax bath. That is the main usual asked questions in physiotherapy. And other than therapies, like there are exercises, isotonic exercises, and static exercise. In the end of this session, I just give you the references of physiotherapy books or Panchakarma books. Then you learn like which one to learn, which one to refer for the Panchakarma in-depth books for the physiotherapy and for other Panchakarma therapies. So it will be easy for you to learn because I think in which way we get it regular books, Dr. Lohit sir books and the Vasant Patil sir books. That is, I think, that is okay for your PG, UG level. I think if you need it more, you have other books also, something like Sarvesh Kumar sir book. That is also good. That you can learn, like that you can refer it. And I think more often question they asked in physiotherapy, like as I said before, the main thing is like electromagnetic therapy and sonobath. So not sonobath, sorry. This one, shortwave diathermy. Okay, that I think they had asked more in from the physiotherapy. I think otherwise like electromagnetic therapy and wax therapy. That is a major question asked from physiotherapy. Okay, because I think in this 10 marks questions won't come. So this you can go. And in this also, like as I said before, pre-operative, post, and present. So three things three steps you have to follow in each the procedure. It may be panchakarma, it may be physiotherapy, like pre-operative, post-operative, and present. And in detail you have to explain. Okay. it okay, then we'll go with Vamana then. Like in Vamana, I think you have seen the syllabus. I think in the next highest marks they had they had given in Vamana and Virechana. So I think from etiology also you can consider from Vamana etiology and the definition of Vamana. I think in major, I think they are asked like no, collection of Vamanopagas and preparations of Vamanopaga and preservation of Vamanopaga, because the indication and contraindication anyway you people will learn. Like as I said before, if you feel difficulty in learning into indication and contraindication questions, at least learn the terminologies of indication and contraindication. And I think like as I said, like collections of and collection preparation of Vamanopaga drugs, specifically preparation of Madana Pippali, that you have to learn. And difference between Vamana and Sadhya Vamana, that you have to learn. That is the most thing. And from the Purva Karma Pradhana Pashats, it's something it start from preparation of the patient. From that level, you have to write while writing the Vamana. If you are explaining the Vamana procedures while writing in your exam, so you have to start with that. And one more thing is like as I said, like Vamana and Sadhya Vamana differences that you have to learn. And I think in Vamana and Sadhya Vamana, the main focus is like Vamanopaga Dravyas, which we use in classical Vamana and Sadhya Vamana. That you have to learn. That I think there is a slight difference in that. And I think in both you have to write indication and contraindication and why, when. And another thing is like Samyak Lakshana, Ati Yoga, and Ayoga. And most often in Vamana and Virechana is Shuddhi. It may be Hina, Madhyama, Pravara. That numbers we say, like according to Acharyas, that you have to learn. Pravara Shuddhi, Madhyama Shuddhi, that you have to learn. And other thing is like Peyadi Samsarjana. I think individually they had asked Peyadi Samsarjana Krama for 10 marks. I think what is Samsarjana Krama and explain Peyadi Samsarjana Krama. I think in based on Avara Madhyama Shuddhi, then Annakala, if you make it in chart, Payadi Samsarjana Krama, that will be easy. Because Payadi Samsarjana Krama, it is based on Shuddhi. So you can write it in a chart. I think Payadi Samsarjana Krama in one Annakala, two Annakala, sorry, two Annakala, three Annakala, like based on the Shuddhi which is there, like that you have to write in Payadi Samsarjana Krama. And I think one more important is Tarpanadi Krama. That you have to learn. And the same thing as like Vamana Karmukata and mode of action both in modern concept and Ayurveda concept, both you have to learn. Like while writing Vamana Karmukata, please use the terminology. Like as I said before, if you're not able to write the shlokas, at least write the terminology. Okay, otherwise it will be again issue. Okay. Mm. And like Parihara Kala, as I said, like in Vamana Parihara Kala and Virechana Parihara Kala, and I think this is all in Vamana Karma, which probable questions I'm telling, not like I'm just telling you superficially, not in depth, so you can get the idea. And I think in one more thing I forgot while writing the Vamana procedure, like the pattern, you should follow something like etymology of Vamana Karma, then definition of Vamana Karma, then whatever they ask, it may be like something like what is Vamana Karma, and then explain the Vamana Pipali preparation that sorry Madana Pipali preparation that you have to explain. Otherwise, you just they may ask like explain Vamana Karma. In particular, not directly they'll ask like something like any Kafaja Vikaras, and they may ask that. Then you have to explain according to the disease. And like as I said, I had explained you about that Janubasti thing the same way. Why you had chosen Vamana Karma to that particular disease, and why you using the particular Snehana for the Snehapana, and why you choose that particular Taila for this Abhyanga which in Vishramakala, and this thing, classical Vamana, like how you calculate the doses. I think it is not necessary to explain the calculations of the Omanopoka Dravyas. At least you know, I have to mention whichever usually we use in Omana. That I think you have to write in not like as I said, not in a paragraph thing. At least as a points. If you mention that can fetch more marks in Omana Karma. And the most thing as I said, like Samyak Lakshana, Atiyoga and Ayoga in Omana Karmas, and Shuddhis like Hina and Madhyama Shuddhis. That is the main thing. And one more thing I forgot, the complication of Vamana Karma, Ati Yoga and Ayoga. I think in both Ayurveda part of view and modern part of view, if you explain, I think most of the time, like electrolyte imbalance, that will be asked. Then if you focus on that, that will be easy. At least the basic knowledge, the complication of Vamana. They think in the as already it is mentioned in your syllabus, in the last point of your syllabus, that emergency management, I think this part will be covered. I think that you have to focus at least electrolyte imbalance. That is the main question which is asked in most of the Panchakarma therapists, especially in Shodhanartha Panchakarmas like Vamana and Varechana and Basti. So you have to mention it. Okay, at least you have to know what it is, the basic thing. Okay. And like as I said, like the Parihara Vishaya, that you have to learn. Okay. Then we'll move on to next one, that is Virechana Karma. Again, if you come to Virechana, the same thing again. Will like introduction to Virechana Karma. I think it is not asked, like most of the time it is asked like classification of Virechana. The main usual question, classification of Virechana, or the one thing is the usual question they ask, the utility of Virechana Karma in health and disease, Swastha and Athara. Utility of Virechana Karma in Swastha and Athara, the most often asked question is that one. And like as I said, like indication and contraindication of Virechana Karma. And in this also, you have to follow the same pattern, that Purva, Pradhana, and Paschat. That is a regular pattern. If while writing the Panchakarma paper, you need to follow that pattern. And again, I think in Kosta Agni Pariksha, while giving Virechana Dravyas, that you need to mention it. And and um, and Vishramakala and Vishramakala, why 3 days gap and 1 day gap in this thing Vamana? That the difference you have to learn, the Vishramakala in Vamana and Vishramakala in Virechana, that you need to learn. And other than like the regular thing like Samyak and Atyoga yoga of Virechana karma. And same thing, like, Shuddhi is like Hina Madhyama. That I think you have that chart, I guess. I think if you see the Lohit sir book, Dr. Lohit sir book, he had given the chart. I think if you learn, that is enough for Shuddhis, that the types of Shuddhis in Vamana also, in Virechana also, that will be better because he had mentioned in terminologies. That will be easy for you people to learn the things. And again, one more thing is like Sadhya Virechana and classical Virechana differences, and indication and contact indication in both of them we have to learn. And other thing is like complication of Virechana. That is the main question was asked. And other one is like Karmakata. Virechana Karmakata and Vamana Karmakata. That, sorry, not Vamana Karmakata, mode of action of Virechana, that you need to learn it. And like if you focus on Virechana in particular diseases, most of the time they are asked like Kushta, Vatarakta. That is a main disease which they ask for writing. Explain the Virechana karma in Kushta, or explain Virechana karma in Vatarakta, or explain Virechana karma in Prameha. That you need to learn. Like as I said, like if example, if you're writing Vatarakta, like question has come like explain Virechana karma in Vatarakta. The same thing we need to learn. We need to write what is Virechana, and why Vatarakta is indicated in Virechana, and what are the things you're using, like in Purva Karma, while choosing oil, why Grithas, why which one is you using in as Neyapana, and which oil is using for Abhyanga in the Vishrama, and which Virechana Dravya you're using for Virechana Karma. That, with the reason if you give, that will be better. I think, as I said before, like if you don't know the shloka, at least mention the terminologies, okay? And like one more thing, that complication which I said, like complications of Virechana, it may be like modern and allopathy, both you need to write it down. And the basic thing is like Karmakata, that you need to go. And I think next one is the main chapter, the Basti Karma. I think the highest marks it come from Basti Karma. I guess the main headaches in Basti Karma, it comes in the classification of Basti. So you need to learn. I think the major question asked in Panchakarma paper is like classification of Basti Karma. So please focus on that. Okay. And even the dose fixation and indication and contraindication are the one. And Basti Yantra doshas, Basti Puttaka doshas, and Basti Netra doshas. I think for the major 5 marks question is like Netra doshas, Puttaka doshas, and Yantra doshas. You need to learn that. At least, like as I said, if you don't know the shloka, at least learn the terminologies. At least learn the terminology. It will be easy for you to write down, because we don't have much time to learn the shlokas now. If you can do it, it's well and good. If you can't, at least write down the terminologies. Okay. The, like as I said, the main very important question in this Basti Karma is like classification of Basti. The majorly asked Karma Kala Yoga Bastis, and the schedules of Karma Kala Yoga Bastis, that is also. And I think the usual asked question is like difference between Anvasana and Matra Basti, or uh, the preparation of Nirva Basti, that they may ask. And usually the regular one, Samyak and Atyoga Lakshana, or the regular asked question is like Vaitarna Basti. Any Basti is like more in a UG paper, it is not like in detail, like as compared to PGs. At least you just know what it is. The majorly asked Bastis are Madhutailika Basti, Vaitarna Basti, and Eranamuladi Basti, and Tiktak Shira Bastis. I think other bastis are very less which they asked. And then one more thing, Ardhamatrika basti. That is also very important. Usually they asked it for 5 marks or the 10 marks thing. And Basti Pratyagamakala, Basti Pratyagamakala, and Asamyak and Ayoga of Basti Karmas. That is usually asked questions from Basti chapter. And Parihara Kala and Parihara Vishaya. That is the most common question in Basti paper they asked. And one more, the very important thing is like in Basti chapter, that is Uttara Basti. Uttara Basti they are asked very most of the time. So I think the direct question won't come. Something like explain Uttara Basti in Vandyatva. It may come like that. So you need to explain Uttara Basti in detail. That's in the same way which I told you like before, like Purva, Pradhana, Paschat, and clinical utility and mode of action. In each therapies, please do write the mode of action and clinical utility. If you do that, it will be you can get more marks. Okay, I guess I think we had covered most of the things in Basti. Hmm. And one more thing is that Basti formulation, the Neuro Basti preparation or Yapana Basti preparations. And I think if you see if you compare your senior syllabus to your syllabus, I think here they are more focused on clinical aspects. Something like explain the principle practice of Basti, Dingradrasi, Amavata, like something like that. So please just learn the basic things while writing the or while choosing the bastis. If you know the basic things, you can write it aram se, like not like any different thing, basic something like gridrasi. Okay, most of the gridrasis are vata vadi, vata pradhana vadi, so you can write it on there. You can go for Vaitarna basti or Erandamola basti. And in Amavata you can Gomutra Erandamola basti, you can go in Amavata or Vaitarna Basti. Same, like in Vaitarna and Eradamula, you can get two varieties. One is Gomutra Siddha, Kshira Siddha. Usually the Kshira Siddha we go in Kevala Vatavadis, Gomutra Siddha we go with in Kapha and Amaja Lakshana. That you need to learn. And in Katigraha also. That's the slight difference if you learn, you can write Aram se the paper. You can write Aram se, like because the main thing because the main thing you learn because of your clinical thing only, na. So whenever you learn the clinical utility, then you can write paper aram se. And once again, the next one is Nasya Karma. Like Nasya, the most asked question is like classification and subclassification in Nasya Karma. That is the big headache because we get more classification according to different acharyas. So please do learn the classification from Nasya Karma. And one major question they asked from Nasya Karma is like difference between Marsha and Pratimarsha Nasya, or difference between Duma Pana and Duma Nasya. That is also majorly asked question in Nasya Karma. Another like regular question, Samyak and Atyoga of Nasya Karma. And I think Nasya formulation, I think it is not needed for you people for the theoretical. It may be they may ask in practical. It is not much in the theoretical, but the same thing, the mode of action and in both Ayurveda point of view and modern point of view, you have to learn. Like as I said, like I think if you see in your syllabus, most in each chapter, they're focusing on principle of practice of Nasya in particular diseases. That you have to learn. Why you have to learn? Like if you're choosing any Nasya karmas in particular, it may be Pakshagata, it may be Apama, Babhavka, it may be Manyastamba or Ardhita. Why? The major questions why? Then you have to, like, I think as I said before, like the basic thing, like in Ardhita, if you're choosing Nasya Karma, why Ardhita is used? Sorry, in why Nasya Karma is used for Ardhita, and in Ardhita, whatever drugs you're using for Nasya Karma, I think most of the time in Ardita we give Nasapana or Nasya Karma. Okay, I think if you don't know the depth of that, otherwise you can go with Nasya. I think three differences you can learn: the Anutaila and Shirabala Taila in Nasya. Like the choice if like something like if you feel Kevala Vata, you can go with Shirabala Nasya, or if you feel it is like Vata Kapacha, you can go with Anutaila. And I think if you feel like it is Kapha Pradhana Vyadhi, you can go with Karpasati Taila. You can do that. This is the basic things you can learn while writing the paper. But like as I said, you have to follow Purva, Pradhana, Paschat, and clinical utility in each therapy while explaining it, and mode of action in each question. If it is for 5 marks, 10 marks, you have to write it. And I think in the multiple questions, I think they may ask. I think most they may ask like the class something like Bastis. Sorry, not Basti. Nasya in Nasya, they may ask like. Dhumapana, Dhumanasya. In that, they may ask us. They may ask for number of classification in according to our different acharyas. Nasya classification number they may ask, or a dose of Marsha and Pratimarsha Nasya they may ask in multiple choice questions. I guess I think while explaining the other chapters, I think we had missed about multiple choice questions. We'll explain, we'll cover now. The thing is like in Snehana, like the multiple choice question, they may ask like Acha Sneha and Pravicharana Sneha, Trivrit and Mahasnehas, and I think in that, like as I said, like Shamanartha and Bhumartha, the slight difference is that may ask in multiple choice questions, and Kavala Gandusha, that is also that may they can ask in multiple choice, or Udvartana and Utsadhana, Udgharshana, that they may ask, and different in Svedana, different acharyas like Agni and Niragni and Sagni Sveda numbers they may ask. Yes, and Parihara Kalas also they may ask. And Vamanopaga Dravyas, the number of Vamanopaga Dravyas that they may ask in multiple choice question, and that the Shuddhis, according to Acharyas, the Vamana Shuddhi and Virechana Shuddhi, like how much that Hina Madhyama Pravara Shuddhis, that they may ask for multiple choice question in Vamana and Virechana. And in Basti, the same thing. Karma Kala Yoga schedule, number of days, they may ask in multiple choice question. And I think dose of Anuvasana and Matra that they may ask. And that's all. And I think in the same way, the Gnasya, I think Shirovarechana Gana, they may ask for 5 marks. That you can learn. At least the individual drugs you have, if you learn it, that will be easy for you. And I think Nasya in Arda, migraine that they may ask. I think Dhumapana preparation that they may ask. I think most of the things we had covered now, and the mode of action of Nasya, like as I said, like while writing the paper, Pura Pradhana Paschat and the Karmakata in terms of Ayurveda, and then in terms of modern concept you need to learn, and clinical utility. The basic protocols you follow while writing the Panchakarma, that will be very easy for you. And and the last question which is there in your syllabus, like compared to your seniors syllabus, the last point in your syllabus is like emergency management and research object. I think emergency management you get it in like in each chapter after Atyoga and Ayoga. I think they're explained in the books like both Ayurveda point of view and allopathy like modern point of view. You just go and refer that those things, and rest all like research updates in Panchakarma. You need to look over research articles. Like, I think in UJ it is very less. In PJs it is more focused. focused on this chapter. I think it is big. I think only it has come for 5 marks. So I think the major questions come from other chapters. So this is only for the 5 marks. You just know what it is. That's enough, I guess. I think in Vamana, I think in the research point of view, if you see, they may ask like different Vamanopakas for Vamana Karma, that they may ask, like recent research update related to Vamanopaka, that they may ask, or in particular some diseases they may ask. Mhm. This is what the majorly asked questions in Panchakarmas, and like I think you have that like as I said, like in your compared to your seniors and your sorry. Compared to your syllabus and senior syllabus, the major one thing is they are major focused on the principle and practice of each therapy. So for that, you can refer Sarvesh Kumar's sir book. I think in that he had explained. There is a chapter in this, and that is a complete Panchakarma book. The author name is Sarvesh Kumar Singh and Vaidya Shipra Rajori. That is from NA Jaipur. I think you can get in Chaukama publication in this book. So you can get there is a special chapter in this book, like which diseases, which panchakarma we can choose. I think and they had explained in detail. That will be easy for you to learn. So you can refer those books. Okay. Mm. If you need it, I can later on. If you contact Dr. Krishna sir, I'll send the details of that book. Okay. And other one, in your UG level, I think Vasant Patil sir's book is enough for the clinical utility thing. And I think Lloyd's book, like for the classical references and other shlokas, and that is also good. And one more book is there. I think I'll send the details of that book. In that book, I think you will get all the shlokas, including basic etymology shloka to the big indication and contraindication, and each according to each acharyas. I think something like we used to read in the first year of our Ashtanga Hridaya. We used to get a small book like that only. We will get a big book of Panchakarma. You will get all the shlokas in it with different acharyas. You can learn whichever you feel easy and comfortable, so you can that will be easy for you to fetch more marks. Okay. And okay then, if you have any questions, you can ask me.
And thank you, madam. Students, if you have any questions, you can ask. Do you have any questions? Or you can post in chat box. Okay, I think there is no question from their side. Thank you so much, madam. Even having a busy schedule, you have given a very good brief like as for our students, and I think they have follow your instructions. And thank you so much for your kindness also. Thank you so much, madam.
Thank you so much, sir.
Thank you, students. We can concluding this topic today, and tomorrow we are having a KC Law 3 by Dr. Ayush Lal, professor in Uttarakhand. He is giving tomorrow at 6:30. We will meet tomorrow, and our recording will be sent to you within 2 days. Thank you.